Hello everyone, I'm Professor Lee of Dr. Wild Herb TV. Over the past 6 months, we've studied the use of the top 10 medicinal plants for each of the 3 most important risk factors for cardiovascular disease, diabetes, hyperlipidemia, and hypertension. We have studied a total of 30 important medicinal plants. Among these are introduced 10 important medicinal plants that improve diabetes, hyperlipidemia, and high blood pressure with just one herb. Even if you use just one of these well, you can improve your cardiovascular problem. So, these are really important medicinal plants. Let's get started. First, it is Ceylon cinnamon. In hypertension, systolic blood pressure was reduced by 1.25 to 5.2, and diastolic blood pressure was reduced by 0.93 to 3.4 in 12 clinical studies that the extract was taken for more than 8 weeks. For diabetes, in 18 clinical reports, after taking it for more than a month, a blood sugar reduction rate was about 8 to 10%, and insulin resistance was improved. In 12 clinical reports on hyperlipidemia, total cholesterol decreased by 7.34, triglyceride decreased by 8.85, LDL cholesterol decreased by 6.18, and HDL cholesterol increased by 2.7. I'm gonna tell you how to take tea. Powder tea, 250 cc of boiling water, 1 to 2 teaspoon powder, leave for 5 to 10 minutes. Take 2 to 3 times a day like tea. The daily amount is 1 to 6 grams. Decoction tea, add 1 liter of water and 3 to 12 grams of dried cinnamon per day. Boil for about 100 minutes. Drink it like tea from time to time. The second is garlic. In hypertension, 14 clinical reports after 8 to 26 weeks of treatment, the reduction rate was 6.79 for systolic blood pressure and 4.79 for diastolic blood pressure. In 33 clinical reports on diabetes, after taking it for more than a month, fasting blood sugar decreased by 10.9 and HbA1c decreased by 0.6, and there are reports of decreased intraocular pressure and macular edema and increased visual acuity in patients with diabetic retinal complications. In 27 clinical reports for hyperlipidemia, reduction rate is 16.87 in total cholesterol, 9.65 in LDL cholesterol, 12.44 in triglyceride, and HDL is increased by 3.19. How to take tea? Powder tea, 250 cc of boiling water, 1 to 2 teaspoon powder, leave for 5 to 10 minutes. Take 2 to 3 times a day like tea. The daily amount is 1 to 6 grams. Decoction tea, add 1 liter of water and 5 to 10 grams of dried garlic slice per day. Boil for about 15 minutes. Drink it like tea from time to time. Third, it is ginkgo leaves. Hypertension was significantly reduced in both systolic and diastolic blood pressure in 6 clinical reports, and there are reports of improved renal function in patients with hypertensive renal complications. For diabetes, in 7 clinical reports, fasting blood sugar significantly reduced and HbA1c decreased by 0.9% after 2 to 18 months of use. For hyperlipidemia, in only some studies, decreased total cholesterol, LDL cholesterol, and increased HDL cholesterol. How to take ginkgo leaf tea? Powder tea, in 250 cc of boiling water, 1 to 2 teaspoon powder, leave for 5 to 10 minutes. Take 2 to 3 times a day like tea. Decoction tea, in early fall, green leaves are collected and dried. Add 1 liter of water and 3 to 10 grams of dried ginkgo leaf per day. Boil for about 15 minutes. Drink it like tea from time to time. The fourth is ginger. In hypertension, 6 clinical reports showed significant reduction in systolic and diastolic blood pressure after taking it for more than 8 weeks. In 10 clinical reports on diabetes, fasting blood sugar decreased by 18 to 21 and HbA1c decreased by 0.57 to 1 after taking it for 8 to 13 weeks. In 8 clinical reports of hyperlipidemia, total cholesterol and triglyceride was significantly reduced. How to take ginger tea, powder tea, 250 cc of boiling water, 1 to 2 teaspoons powder, leave for 5 to 10 minutes, take 2 to 3 times a day like tea. In decoction tea, add 1 liter of water and 3 to 10 grams of dried ginger slice per day. Boil for about 100 minutes. Drink it like tea from time to time. The fifth is ginseng. In 23 clinical reports, after taking it for 4 weeks to 6 months, reduction in systolic and diastolic blood pressure, fasting blood sugar, insulin resistance, total cholesterol, LDL cholesterol, and triglyceride were all significantly reduced. Take ginseng tea, powder tea, 250 cc of boiling water, 1 to 2 teaspoons powder, leave for 5 to 10 minutes, take 2 to 3 times a day like tea. Decoction tea, add 1 liter of water and 3 to 10 grams of dried ginseng slice per day. Boil for about 100 minutes. Drink it like tea from time to time. The sixth is red yeast rice. In hypertension, among the 12 clinical reports, some studies reported a reduction in hypertension and arterial stiffness. For diabetes, fasting blood sugar 8.28, HbA1c 8.82, and insulin resistance decreased in 10 clinical reports. For hyperlipidemia, in 27 clinical reports, after 4 to 48 weeks, total cholesterol decreased by 13.32 to 18.36, triglyceride decreased by 8.1 to 23.36, LDL decreased by 7.56 to 28.94, and HDL cholesterol increased by 2.5. How to take red yeast rice tea. Powder tea, 250 cc of boiling water, 1 to 2 teaspoons of powder, leave for 5 to 10 minutes, take 2 to 3 times a day like tea. Decoction tea, add 1 liter of water and 1 to 5 grams of red yeast rice per day. Boil for about 30 minutes. Drink it like tea from time to time. The seventh is black cumin. In hypertension, systolic blood pressure decreased by 7 and diastolic blood pressure decreased by 5 after 8 weeks in 11 clinical reports. But in some studies, it was not effective. In diabetes, 17 clinical reports showed highly significant reduction in fasting blood sugar, 2-hour postprandial blood sugar, and HbA1c level. For hyperlipidemia, in 25 clinical reports, total cholesterol decreased by 15.65, LDL decreased by 14.1, and triglyceride decreased by 20.64, and HDL cholesterol increased after 3 weeks to 1 year of use. How to take black cumin tea, powder tea, 250 cc of boiling water, 0.51 teaspoon powder or oil, leave for 5 to 10 minutes, take 2 times a day like tea. Decoction tea is not necessary. The most important active ingredient, cymoquinone, is not water-soluble, so it is not easily extracted when decocted with hot water. It can be destroyed by high heat or evaporated into volatile form when heated, so it should be taken as oil if possible. Eighth is bergamot orange. In hypertension, systolic and diastolic blood pressure were reduced in 16 clinical reports. In diabetes, blood sugar and insulin resistance were reduced in 5 clinical reports. In hyperlipidemia, after 1 to 6 months in 12 clinical studies, looking at the reduction rate, total cholesterol 12.3 to 31.3%, LDL cholesterol 7.6 to 40.8%. triglyceride 11.5 to 39.5%, and HDL cholesterol was increased. How to take bergamot tea, powder tea. Check polyphenol amount of product. 250 cc of boiling water, 1 to 2 teaspoon powder. Leave for 5 to 10 minutes. Take 2 to 3 times a day like tea. Decoction tea. Add 0.5 liter of water and 4 to 12 grams of dried bergamot per day. Boil for about 15 to 30 minutes. Drink it like tea from time to time. Is artichoke. In hypertension, systolic and diastolic blood pressure decreased by 2.3 to 3.3 after 12 weeks of use in 3 clinical reports. In diabetes, 3 clinical reports showed a decrease in fasting blood sugar and an improvement in insulin resistance after 8 weeks. In hyperlipidemia, 14 clinical reports showed that after 4 to 8 weeks, LDL cholesterol decreased by 1.7 to 49, total cholesterol decreased by 12 to 55, and triglyceride decreased by 3.34 to 9.2. This effect is 3 to 4 times more reduction compared to the control group. How to take artichoke tea, powder tea, 250 cc boiling water, 1 to 2 teaspoon powder, leave for 5 to 10 minutes, take 2 to 3 times a day like tea. Decoction tea, add 1 liter of water and 4 to 6 grams of dried leaf a day. Boil for about 15 minutes. Drink it like tea from time to time. Lastly, number 10 is green tea. In hypertension, in 24 clinical reports, systolic blood pressure decreased by 3 to 5 and diastolic blood pressure decreased by 1 to 2 in patients with stage 1 hypertension at 2 to 8 weeks. In hypertensive patients with left ventricular hypertrophy, systolic blood pressure decreased by 6.6% and diastolic blood pressure decreased by 5.1%. In diabetes, fasting blood sugar and HbA1c levels were significantly reduced in 5 clinical reports. In hyperlipidemia, total cholesterol decreased by 7.62, LDL cholesterol decreased by 5.8, and HDL cholesterol increased after 2 to 48 weeks in 55 clinical reports. How to take green tea, powder tea, 250 cc boiling water, 1 to 2 teaspoon powder, leave for 5 to 10 minutes, take 2 to 3 times a day like tea. Decoction tea, add 1 liter of water and 2 to 5 grams of dried ground leaf per day, boil for about 15 minutes. Drink it like tea from time to time. Do not drink on an empty stomach if possible. I'll tell you about side effects and precautions. This is common to all 10 plants. 1. Allergy, stop. If severe, visit the hospital. 2. Gastrointestinal problems, stop for 2 to 3 days and start again with a small amount. 3. Regular check of blood sugar, blood pressure, and cholesterol. 4. Consult with a doctor when taking medications. 4. Diabetes, hyperlipidemia, and high blood pressure. 5. Consult your doctor when taking anticoagulant or antiplatelet drugs. 6. When taking for a long time, take a 2 to 4 weeks break after 3 months. 7. Pregnant women, children avoid for long-term use. These are the side effects and precautions you should be aware of each medicinal plant. Ginger and artichoke, increased bile production and gallbladder contraction may cause pain. If pain occurs, discontinue use and consult a doctor if you have biliary tract disease. Ginseng, increased pulse in case of hypersensitivity, stop and restart with a small amount. If you have insomnia, do not take it before going to bed. Menstrual cycle change or breast tenderness, start with a small dose after stopping for 2 to 3 days. Radish rice, discontinue if you experience muscle pain or muscle weakness. And consult a doctor if you have liver disease. Green tea, caffeine sensitivity, such as insomnia, nervousness, increased heart rate, stop for 2 to 3 days and restart, or use decaffeinated green tea. I mentioned 10 valuable medicinal plants that clinical effects were reported in improving the 3 most important cardiovascular disease risk factors. If you choose the one that suits you and drink it regularly as tea, it will be of great help. For detailed information about each medicinal plant, please refer to Dr. Wildlife TV and the world's top 10 video for hypertension, hyperlipidemia, and diabetes. Thank you for your hard work starting, and see you again.